So let's find out a little bit more about this program called Guru. Gone are the days of drawing on your bracket table cover and trying to explain things to patients. Gone are the days of taking a number 2 radiograph and trying to hold it up to the track light and draw a little inverted triangle and draw a circle with a very sharp pencil. Now, what we finally have the ability to do is to put the images, the patient's images, the graphic images, whatever you've got into this program, and actually annotate them, draw on them, and do a voiceover with them and completely change the way you educate your patients. Now, Chris, I know that you were talking earlier to me about the ease of use of Guru. You want to explain it to everybody else, please?
Yeah, what was easy right from the beginning was the install. The install was so simple. Second, within about a half an hour, our team was up and running. Everybody on my team knew how to use Guru at its basic level.
You simply drag and drop to import your patient's actual intraoral images and digital x-rays into Guru's patient management system. Guru's unique stop, draw, and teach feature lets you point out areas of concern with a writing stylus or a mouse. The heart of Guru is over 200 original 3D animations and images, the highest quality, most patient-friendly teaching tools in dentistry.
What was great about this is that we were able to customize this to our patients' individual needs. Your patients and my patients, they have different needs, but yet with 200 different animations, I can custom place those to tell that patient's story for whatever their needs may be at that time.
And then you've got the added aspect of the ability to drag and drop individual patient images, whether they be from an intraoral camera, an extraoral, digital SLR, radiographs, all that kind of thing that you can then put into that, draw on those as well, and annotate them. And then if you really want to, even picking up a microphone and doing the voiceover and actually explaining it for the patient. And then you can even go so far as to email it. You can get the patient email address, you enter that into the program, it uploads the videos to the Guru web server, it sends the patient a link in an email. Patient clicks on the link, it goes right to that site, which is secure, shows them the video that you custom designed for them. And what I think is really cool is it even keeps track of, the website does, how many times the video's been viewed. So you can actually see, did they watch it? And if they did, how many times?
Yeah. I've had so many patients come into my office that have the same particular needs. The question always becomes, do I do a bridge? Do I do an implant? After I've created some of those custom playlists, it's very nice to be able to go back to those playlists you've created that you've customized yourself. Like you said, maybe with your own voiceover, and be able to play those for somebody, because we do tell the same stories many times to different patients, and Guru has worked out well. I gotta tell you, I don't think there's any other software like it. It's one of the best education softwares I've ever put my hands on.
Well, and when you talk about customizing or simply, providing the information that you've got and it's always going to be the same, a couple of things on that. Number one, with hygienists, it's hard, at least for me, it's hard for me to talk continuously and to actually, provide the care. And I know it's sometimes difficult for hygienists as well. So the neat thing about this is if you've got a monitor that you can flip up and over the patient, then the hygienist can treat the patient and the hygienist can concentrate on what they do best, which is, treating the patient. And the animations will show the patient what they need. And it's always consistent, it's always the same, nothing gets left out.
As a hygienist, Guru is really valuable to me because the most important thing that I do is teach. And it is a fantastic teaching tool.
Guru is a great product, and when you look at it, you have all these different softwares out there that are under the heading of patient education. Mm-hmm. But what I really like about Guru, it's supported by one of the biggest dental industry leaders, and that's Henry Schein.
Right.
Yeah. The other thing that's great about Guru is the Guru TV. When you look at Guru as an animation-based program, it's fantastic for us, it's fantastic for our team. But Guru TV now has those animations on a loop running in the office. I think it's very common nowadays for dentists or any type of office to have some sort of educational software running in their lobby. Now you take this Guru animations, they're so specific and they're so educational that a lot of the questions that they had before they came back are answered right there inside the animations.
And because Guru TV and Guru in the back are the same, you've got that, once again, the consistency of it looks the same as it did in the reception area as it does in the clinical area. It's a great program. Chris and I love it. If you want more information, get on the web and go to howdoyouguru.com. Thanks for watching.